Hello, my name is Bill Wagner, and I have 16 years of healthcare payer experience. This experience includes working in IT, working in data analytics, and also working in provider facing relations, working with different provider associations. And today I'm here talking to you about a practical approach to dropping healthcare costs, increasing healthcare quality using artificial intelligence and natural language processing to supplement healthcare providers in the sense of providing them with the help that they need in the current market. AI has the potential to be revolutionary in the healthcare field. It can save lives, simplify processes, reduce administrative burden, and drive savings from all the reduction in waste, all the waste that we deal with in the healthcare field. However, it must be provided methodically and within certain guidelines for it to be effective. In other words, we really need to understand it, know what it is capable of, and what it is not capable of. The world of today, our patient experience, who is really our consumer, our not just consumer, but partner. The patient experience is relatively the same as it was back when I was a kid back in the 80s and 90s. I'm 44 years old, and I have seen the evolution of healthcare, and it's never really happened at the doctor office level. Patient outcomes are not improving with the leaps and bounds that technology is enabling, and the technology, treatment, information that we have is light years ahead of what we had back in the 80s, 90s, 2000s, 2010s. And it is growing far more rapidly. Our information that we have is abundant. We have too much information. We have a more complex understanding of how different parts and different specialties of providers interact with each other within the holistic view of the human being. And we're understanding more about outside factors that impact patient health, such as lifestyles, genetics. We are understanding new testing methodologies, new ways to retesting. And on top of all of this information, we have to learn far more complicated billing methodologies and also administrative burdens, such as the bane of all healthcare: prior authorization, regulatory approval, regulatory management, and all of those different factors. It's too much for a person to manage, or even a group of people, because of its complexity. Approximately 30% of today's healthcare volume today's data volume is in healthcare. That's an immense amount, and it is growing at a compounded rate every single year. So by 2025, it'll be 36%, and it's going to keep growing. And if you really want to put that in perspective, the data size of healthcare in 2015 was 8.6 gigabytes, well into the internet age and data analytics and cloud age. Now it's 40 gigabytes. And a gigabyte is 1,000 terabytes, which is 1,000 gigabytes, gives you an idea of how massive 1 gigabyte is, much less 80. A single patient generates 80 megabytes of data each year on average, and that was in 2017. To put that in context, 32 megabytes is the largest Word document, and that is 2,667.67 pages of written Word in Microsoft Word. So that should give you an idea of how much information a patient alone is generating. Now, what's that look like for a doctor or an administrator or a hospital? It's compounded with not just the patient data, but the research data. So back in 1990, you had on average, the annual average for research articles and development of healthcare knowledge was about 221 journals. And now we're at 1,622 in 2017. So even today, that number has grown even more. And all of these journals and documents, it's information overload that nobody can really keep up with because the information is flooding out from various sources, including our pharmaceutical, biotech, and digital areas, because of how much is being invested in it. In 2010, we invested $8.5 billion, and adjusted for inflation, as these numbers are, we have right here $28.3 billion, a 232% increase. And that's in biotech and pharmacy. In digital health investments, we've gone from 10 billion up to $30 billion invested from 2010 to 2018. So all of this is generating vast amounts of information that are saddling providers, hospitals, and administrators with information overload. Now, looking at what this means, as well as what payers are doing to providers, which as a payer, I know full well what that impact is. The biggest thing is for providers is the administrative burden, learning new things, continuing education credits, coming up to date with new treatments, plus filing claims, billing patients, getting things approved in prior authorization, knowing what medicines that the patient is able to get covered by insurance and not able to get covered by insurance, and then following an authorization process there, as well as step therapy. If you want to understand that, if you think 40 hours a week is your standard work week, half of that week is going to be doing administrative work and not treating patients. And if you look at the burnout reasons, every provider in every age group says that administrative burden is the number one cause of burnout. So why does this need to be this way? Well, providers need administrative support to do all of the things that are being asked of them. They can't do that and see patients. And it drives up costs because you have to pay for those people or those companies to come in and provide those services. And the impact on the medical system is an absolute drain and causing skyrocketing prices. Adjusted for inflation in 1970, we barely crested $15 billion in hospital and healthcare administration. In 2020, we are at $250 billion, a 1,663% increase overall in spending in healthcare. So how do we fix this? Well, the solution that everybody's throwing around is AI and NLP. So what does that look like and how does it integrate? Well, there's a lot of fear around it. And to set things straight, AI does not look like these guys. It's not taking over your world. It is not causing rampant destruction and errors. It's more like these guys here. It's there to help, to supplement, to provide guidance and information that you need at that moment to make decisions as a healthcare provider. The control is still in the doctor's hands, but it is being supplemented with a much more affordable way and much less burdensome way to accomplish tasks. So the solution, we need to provide doctors a way to see the patient holistically, keep up to date on their medical history, what prescriptions they're taking, even their Fitbits, what are they saying about them? We need to give doctors tools that look at multiple data sources across the world regarding treatment, innovation, types of care, all of those things, and reduce duplicative testing and extras that don't need to be there, that don't have value, um, and identify the latest treatment options to a customizable self, because we can look at the patient as an individual holistic being and gear the treatment for what is right for them with the information we have. And we need to get rid of that administrative burden. It saves healthcare companies money, yes, but at what cost? And I liken it to like this. If you are a doctor's office and the solution today is to demand higher fees, and with those higher fees comes more administrative burden. And so you're racking up cost along with the fees. The, that's not what you want. You want to say, I want to make more out of what I'm getting. So would you rather be a doctor's office that has $600 worth of revenue and $500 worth of expense, or $400 worth of revenue and $200 worth of expense? So, and we're going to go into some of the details here of how this looks. And we're going to look at integration of AI and NLP and EMRs, billing software, prior auth software, safe and secure cloud storage, and processes that eliminate waste. And that's the goal. We got to stop relying also on patient memory and doctor memory. There's no reason the doctor cannot have the full patient medical file brought over, summarized, and presented to them so they know what's going on. So we're going to do whole patient, whole provider, whole office. Right now, when the patient comes in, the patient is fills out tons of paperwork, which takes an immense amount of time. And then they are looking at, they are sitting there and they're talking to you and they're telling you things, and you're listening and trying to sort through what you need to hear and what you don't need to hear. An EMR system with a microphone can look through everything said there, take the notes, and then point out key areas of concern that anybody could have missed because of the barrage of data you're getting. It could pull past test results, not only the ones that you prescribed or any doctor prescribed, but the ones that the other doctors and hospital centers prescribed as well, to prevent duplicative testing. It can grab other doctor notes and compare and analyze them to your notes. Where's their discrepancy? What is the issue going on? What are some red flags that are popping up? We have wearable medical devices. It can pull information from those. And again, this is all with patient permission. The patient consents to you doing this and takes a look at how active is your patient? How are they sleeping? What are they doing day to day? Pull hospital records and also transcribe a patient conversation. All of that can get filtered into this EMR EHR. So the system's there, it's listening, it's pulling the information. The patient doesn't have to fill out a ton of paperwork, and it's creating this huge patient profile for you and then narrowing it down with refinement and AI analysis using NLP, because it can understand a human conversation, and refining it down and then presenting to you everything it finds. And if you don't agree with it, you can go back and catch everything else that it refined out of there to see if it missed anything. You're still in command. So the patient has a better experience, less forms, clear notes, and reduced information overload. So what does this mean for the provider? The whole provider, this system goes out and grabs insurance guidelines, including the TPAs, third-party administrators, like your EviCores and your AIMS and other prior auth and software, or go out to medical societies and grab what the standard of care is. It can look at all the treatment options out there, not just the ones you've been made aware of, but other ones that are showing progress or show potential. It can do peer review article readings regarding the symptoms. So it takes those symptoms, it goes out online and it grabs those peer reviews and says, you know what, a patient exhibiting all of this holistically in their body, including the stuff they didn't tell you about, might have this. We should bark up this tree first. You can pull pharmacy documents so you know that any medicine you prescribe will not have an interaction with another medicine. Medical journals and like I said, standards of care. All of that flows into the EMR and combines with the patient info, gets refined by the AI, can help diagnose something or confirm a diagnosis. And if, again, you can go back in there, look at the whole thing yourself and say, I agree or disagree, because these systems learn over time and you teach them over time, and they are providing the power that you teach them. And then it finds it. And then again, better care, less errors, less unnecessary patient testing and treatment. I'm going to tell you a story, personal story. In 2020, right when I caught COVID, I caught something else. It was a nasty, nasty, rare condition. It took 8 doctor visits with 5 different specialists, including an ER, 4 CT scans, 4 ultrasounds. They were looking for cancer and they couldn't find it. And they thought that's what it was. That's what it has to be. And all of these specialists said, it's got to be cancer. We got to do another surgery. We got to do another testing. And guess what? It was none of it. It was vasculitis. They just looked at one lab study. The person who figured it out had been a pathologist. Turned out it was my psychiatrist. Looked at my testing and said, oh, you've got an autoimmune condition. You need to go see a rheumatologist. My insurance company spent $250,000 barking up the wrong tree. And now here we've got this whole office. And this is the key part to help the doctors out the most. These systems can go out and read the insurance requirements. What does an auth require? Every auth system is different, has different requirements. Every insurance company has different requirements. It can go out, analyze those, and let you know exactly what's needed. And then it can go out and complete all the forms, attach all the documents. You don't hit anything except for the submit button. It's doing it automatically. And it heard you say, well, I want you to have a CT scan. So it knows what you're thinking of doing. And before that patient leaves the office, you will know exactly what you need to do to get that patient the CT scan. It can go through the medical records and compile everything that anybody would ever need to know for this person to get services, and submit all of that information to the appropriate place, because it's reading that patient's specific insurance requirements and it knows exactly what those are, where to submit them to, how to submit them to, and you'll get faster responses. And as those companies change up things, it can learn, adapt, and acclimate. You don't need staff to do this. This is all paperwork that can be done automatically today. And the best part is the patients, their process is much easier. It's not just scheduling, but when they walk in the door, they can just fill out a tablet. They don't need to interact with somebody. They can pre-fill out all of their paperwork and submit it in advance. And a lot of doctors' offices are doing that, but not all of them. It can prep you for that patient visit by getting you the information, the complaint, and everything that patient is experiencing. So you already are walking into this with an idea of what you're going to encounter. So that patient comes in, they fill out, they sign the forms for HIPAA and all those things. The rest of the stuff is already loaded in. Most of it automatically by the EMR, because it has a lot of that information. So anything else that needs to be filled out paperwork-wise will be left blank and then highlighted, but most of that paperwork is filled up in advance. They get called back, they talk to you, you already know the conversation, what you're going to be talking about. And then as soon as they're done and you've got all the information you need, they go out and get scheduled for the next one. I don't know why we use schedulers. Schedulers are a roadblock, not an assistant, because Why can't I just look at an Excel-like sheet or an Outlook-like sheet and see where the doctor is available? The system will point out when that doctor wants to see me again. And then I pick the time and the day, and that's all I have to do. I don't need to talk to somebody or have a conversation. And the process goes a lot faster and is a lot more accurate. And there's a whole lot less of, well, can you do this day? Can you do this time? Can you do here? Can you do that? It makes it so much more efficient and it lowers your overall cost. Less paperwork, you got more time with patients talking about what you need to talk about, and you've got lower overhead. So you're more of that $400 revenue making with $200 worth of expense than the 6 and 5. So going forward, what we really need to do is we need to stop dragging our feet. We drag our feet in healthcare when implementing tech. We're great at sprinting ahead in developing that tech, but we're the last people to actually implement what we develop. We need to embrace these new technologies, because if we don't start lowering cost of care and reining that in, eventually the government's going to have to do that. And that could turn out to be a hot mess and could really invoke a lot of changes and problems in our lives. The technologies that lower cost are more valuable than the technologies that increase revenues. A fancy machine over here that you're charging patients for because it's the latest and greatest versus one that gets the job done. That fancy machine might increase your revenues, but it's also going to increase your cost and expense. You just want to drop these costs and increase accuracy, analysis, and understanding of that patient. That will bring you higher quality care and bring that patient higher quality care. And then we need to use the tools at hand to improve quality of care, cost of care, and availability of care by focusing more on the patient instead of just the tech or the administrative burden or all of the other things that we're having to confront today. I would like to thank you for my time. I could dive a lot deeper into this, but I'd like to take some questions of yours.
What an excellent presentation to end this conference day. A huge thank you to all the speakers for their insightful talks covering state-of-the-art NLP and LLM research and best practices for healthcare and life science. Today, we learned about the significance of amalgamating structured and unstructured data to create comprehensive longitudinal patient stories, the transformative potential of AI in advancing precision oncology, the challenges in sourcing diverse and high-quality data for responsible AI applications. Additionally, we shared insights on using large language models to enhance model accuracy and also to optimize and predict inpatient violence and delirium using NLP in an acute care setting. Another big thank you goes to all of you for joining this community, this conference yesterday and today, and for contributing with your questions and ideas and your own experience. We do this conference for you. If you would like to watch any of the sessions again or watch those that you have missed, you can come back and watch them right here in the replay sections here on the conference platform on demand. The sessions will be accessible for the next 2 weeks. Also, please let us know how you like the event so that we can make an even better one for you next year. We have shared the link to the feedback form right here in the chat. Thank you. For all those who would like to dive deeper into applied NLP, we'll be back in the following week with 5 days of virtual live NLP and LLM training courses and certification. These 5 days of workshops will walk you through state-of-the-art LLM and NLP using Johnson Labs open source library, healthcare-specific library, and visual document understanding library. Check out the link in the chat to see details and to register. Once more, thanks again to all of you. I'm very proud of this amazing community. Please do keep in touch with me, with the other people here, with the Johnson Labs team, and have a wonderful rest of your week.